Hi, I want to talk to you today about health information because I see a lot of health information out there that people are believing, they're following on social media, they're liking, but the recommendations have no grounding in scientific fact. I don't know if it's the biceps of the presenter or the number of likes they're getting on YouTube, but it's not the quality of the evidence they're reporting. There's a lot of bad information out there, and the consequences of following bad information are not only that when it comes to your health, are not only that you won't get the purported health benefits by following the intervention, but you might be missing out on something that could actually be helpful. So this morning I was searching the medical literature on what to recommend to people for a healthy diet. I came across an article that provides a good illustration of the process I use to vet health information, and I wanted to share it with you. So I've developed this 8-step process, and I'll show you how I apply it in a moment. My goal here is to provide you with a way of having confidence in what you're coming across online. So the study, it was published in the New England Journal of Medicine in April 2021. It was a prospective cohort study of 135,000 people across 18 countries. And the researchers did dietary assessments at regular intervals, determined the glycemic index of the foods eaten, and then broke the population into quintiles based on how high the glycemic index of their diet was. And then they determined whether or not the different quintiles of glycemic index died during the follow-up period. So glycemic index is the amount that your blood sugar is raised when you eat a particular food. And they wanted to know if a higher glycemic index diet increased risk of death during the 9.5-year follow-up period. And what they found was that indeed, people with the highest glycemic index diets had a higher risk of premature death than people with low glycemic index diets. Now, for most health pundits, that's all that they need to hear. They're going to go out on YouTube and start proclaiming the benefits of a low glycemic diet. Let's look at this study just as an example of how we can peel back the veil on what to believe and what not to believe, because the answers for this study is going to be surprising. So the first thing we look at is the journal's impact factor. A journal's impact factor is the number of times an average article in that journal was cited in a 2-year period. Most journals have an impact factor of 1. An impact factor of 3 is considered good, and 10 or greater is considered excellent. It means that for an average article in that journal, that article is cited 10 or more times in the medical literature in a given 2-year period. The more times an article is cited, the more impact it has had on the community that studies that topic. And the more higher an impact factor of a journal, the more influence and respect that journal has within the community of researchers in that field. So less than 2% of journals have an impact factor of 10 or greater. The New England Journal of Medicine has an impact factor of 91. It's one of the highest, if not the highest, impact factor journal in the world. So this study definitely passes muster when it comes to the journal's impact factor. Thank you very much. Next is, what kind of a report is this? Now, the New England Journal of Medicine can publish commentaries or expert guidelines, which are not deriving conclusions from data, but making inferences and providing opinion based on consensus. And I want to exclude people's opinions, even groups of people's opinions, and just look at the evidence from trials and what can be concluded from those trials. This was a prospective cohort study. They looked at people's diets and they looked at the outcome of mortality. So this was the real deal. We get a pass for that. Next is the study on humans? Now, I have no problem with research done on yeast and golden retrievers and amoeba. And they're important in understanding mechanism and preliminary trials before we study the effect on adults. on humans. But in my mind, I'd rather, if I'm going to have an option of following information that's been vetted in humans or information that's been vetted in golden retrievers, I'll take humans. So this criteria, yes, the study looked at humans. So we have another pass there. Next is relevant pre-existing conditions. So the question is, are we talking about the general population? I work with people in the general population on prevention. And so I want to know what works in people without a specific condition of interest. So if they're looking at mortality in this study, I want to know that the people at baseline didn't already have heart disease, because the majority of people I'm going to be talking to don't have heart disease. So I'm looking for no relevant pre-existing conditions so that I can generalize those findings to the people I see. Let's look at this study's results, and we can see that they looked at all participants' outcomes, but then they thankfully broke the groups up into whether or not they had cardiovascular disease at baseline. So I could look at the data for those who did not have cardiovascular disease at baseline. So that is what I was looking for. And I give the journal a pass, the study a pass on that criteria. Next, I look for a similar demographic to the US or a US population. There are many confounding variables that can occur when the demographic is different from the people I'm talking to, which are US population. So I want to make sure that the demographic of the population was similar to the people I meet on the street. And if you look at this study, they looked at 18 different countries, and they looked at low income, middle income, and high income. But what they did was separate out the data so that I could look for people without cardiovascular disease, and I could look for people only from high-income countries. So I can have confidence that the results were in a population that's going to be similar to the one I'm going to be talking to, and similar probably to you. So again, the study gets a pass on all three measures of the population. Next, we're going to look at the outcomes. First, I'm looking at all-cause mortality. A study that reports all-cause mortality has the advantage of not missing any unintended effects of the intervention. So if I look at just diabetes risk, and I look at an all-meat diet, and I find that people in an all-meat diet have a lower risk of diabetes than people who eat a Mediterranean diet, I might conclude that I should eat a all-meat diet. But if I look at the question of all-cause mortality, I might see that people who eat an all-meat diet die sooner than people who don't. So there must have been something causing health harms to people eating an all-meat diet that was missed when we looked at just diabetes, but was captured when we looked at all-cause mortality. So I'm only going to include in my recommendations studies that show an effect on all-cause mortality. And this study looked at different outcomes, but included total mortality. So that was exactly what I was hoping, and this study gets another A+ for that measure. And the last two measures are for statistical significance. The first is the p-value. A p-value is the probability that the effect we're observing was completely by chance. If you have a low p-value, it means that you can have a lot of confidence in the results. If you have a high p-value, and the criteria is usually greater than 0.05, then it's a high likelihood that this was a totally random result, that you wouldn't actually find this in the real population. So if we look at our study, we're looking at no history of cardiovascular disease, and we're looking at high-income countries. Our p-value is 0.23. So although there was an increased risk of mortality for people in the highest quintile of glycemic index compared to the lowest, there was a high likelihood that these results were completely random, a 23% chance, nearly 1.25 chance that this was a totally random finding. So unfortunately, this article, for the subpopulation we're interested in, fails. The other measure we look at is the confidence interval not crossing 1. So a confidence interval is the likelihood that the groups actually differ in the real world. And we don't want the confidence interval to cross 1. If this interval crosses 1, it means the compared groups are no different. If we look at this study, the confidence interval is reported in these parentheses, the 95% confidence interval. So although there's an 8% increased risk of mortality in the second quintile of glycemic index compared to the first, we can only be certain that this was the range, 0.92 to 1.26. And that includes 1, which means that it's quite possible that the groups were exactly the same, that glycemic index had nothing to do with mortality. And if you look at the other metrics, the confidence interval crosses 1 every time. So this means that the results could just as likely have happened because of chance. And so for confidence interval, because it crosses 1, we have to fail this study on that measure. So we have a lot of things in favor of this intervention. Its impact factor, the fact that it's a prospective cohort study on humans. It separated out people without pre-existing conditions. It separated out high-income people. It looked at all-cause mortality. But the p-value was 0.23. It was higher than 0.05. And the confidence interval crossed 1, which means that we can't be sure that the results are not completely arbitrary and occurred by chance. So wowzers, even though it was New England Journal of Medicine and prospective cohort study, it fails on our second measure. And ultimately, if a study fails on any of these metrics, I throw it out. It's not worth my time following. And believe me, there are enough studies that meet all this criteria to keep you busy. So if this article comes across in social media and it's in New England Journal of Medicine and that's what they report, that's not good enough for what to follow in your own life, in my opinion. So I don't know if you're going to take these recommendations to heart and apply this 8-step process every time you hear a health claim, but I would ask that if you are a consumer of health information, that you consider these aspects of the information presented. How do you compare health claims you come across? Well, this is an effective strategy. Is the person who presenting information giving you their transparent process for vetting their information, or are you following it just because they're them? So in summary, if you're going to live longer and healthier, then it means you're following advice that is the best it possibly can be given the state of medical science. And there's far too much information out there that's not worth your time or money. I have a program that we're launching in September, next month, that will focus on a healthy diet, and I'll be presenting the results of an evidence review using this 8-step formula so you can have confidence in what recommendations are presented. You can learn more about this program by just writing a comment below that you want to learn more or sending me a message. Thanks.